Assalamu alaikum everyone. Today the topic of discussion is thalassemia. What is thalassemia? Thalassemia is a type of microcytic anemia which occurs due to defect in the globin chain of hemoglobin. We have six different types of globin chains which are alpha, beta, gamma, delta, zeta and epsilon. These different types of chain combine in different proportion to form different types of hemoglobin. So we have HbF. HbF is a fetal hemoglobin which is composed of alpha 2 and gamma 2. It's about 85% in the newborn, while in adult it is present about 0.3 to 1.3% in about 25% of adults, while greater than 3% has been also recorded. Another type of HbA is HbA, which is adult type of hemoglobin, which is composed of alpha 2 and beta 2, and it is present in about greater than 95 to 98% of adult, while in newborn it is present in up to 15% of cases. HbA2 is composed of alpha 2 and delta 2. In adult it is present up to 2 to 3%, while in newborn it is present up to 0.5%. Some point about hematopoiesis. So hematopoiesis before birth occur in yolk sac, spleen and liver, while after birth it mainly occurs in bone marrow, and it also occur in spleen, liver in case of chronic anemia, and in some hematologic malignancies like Hodgkin lymphoma. Now overview of thalassemia. So we have mainly two type of thalassemia. One is alpha and the other is beta thalassemia. Alpha thalassemia we have further four subtypes which are silent carrier, alpha thalassemia trait, HBH and HB-BART. While in beta thalassemia we have beta thalassemia minor, beta thalassemia intermediate, beta thalassemia major, and also another type which is known as sickle cell beta thalassemia. Now, gene involves in different types of thalassemia. So, alpha thalassemia in silent carrier we have one defective allele. In alpha thalassemia trait we have two defective allele. In HBH we have three defective allele, while in HB-BARTs we have four defective allele, which consist of four gamma chains, gamma tetramers. Then in beta thalassemia we have beta thalassemia minor, beta thalassemia intermediate. So in minor we have one defective allele. In beta thalassemia intermediate we have two defective allele, and in beta thalassemia major we have two defective allele. In major we have absent both the beta chains, while in intermediate we have reduced both the beta chains are reduce one beta chain and the absent other beta chain. We also have sickle cell beta thalassemia, which is a combination of beta globin chain and one defective HBS allele. So we have either reduced beta chain with HBS or we have absent beta with HBS. Then epidemiology. So beta thalassemia is most commonly seen in Mediterranean descent, while alpha thalassemia is most commonly seen in Asian and African descent. Alpha thalassemia is more common in Asian and Africa. So Alpha, Asia and Africa. You can remember it by this. We will go toward the etiology. So what is the underlying cause? There is gene mutation in beta thalassemia occur due to point mutation in promoter sequence or splicing sites, beta globin locus, which is present on short arm of chromosome 11. So point mutation occur at chromosome 11, while in alpha thalassemia we have deletion at least 1 out of 4 existing alleles. The alpha globin chain cluster is located on chromosome 16. Alpha globin chain is controlled by two genes in total of 4 alleles, while beta is controlled by one gene and two alleles. So we have a total of four types of alpha thalassemias, while two major types of beta thalassemia. Alpha thalassemia, so and the pattern of inheritance of the thalassemia is autosomal recessive. Alpha thalassemia, so our globin genes are coded by total of four alleles, and we have four forms of the disease. The severity of the alpha thalassemia depends on the number of defective alpha alleles. In silent, we have one defective in alpha thalassemia trait, which is known as minor form. We have two defective alleles. The deletion can be cis deletion or trans deletion. Cis deletion occur on the same chromosome, which is common among Asian population, whereas trans deletion occur on two different chromosomes and are more common in African population. Children of parents with two genes deletion and cis are at high risk of developing HP part. Then we have the third type is HBH disease, which is known as intermediate form. We have three defective alleles result in excessive production of pathologically altered HBH. Here we have four HP chains. So we have four beta chains which form beta tetramer, while in HP BART, which is known as major form, we have four defective alleles result in excessive production of pathologically altered HP BART consist of four gamma chains or gamma tetramer. In beta thalassemia, the beta globin chain are coded by a total of two alleles, one gene. So there are mainly two forms of the disease. One is beta thalassemia minor or beta thalassemia trait having one defective allele, while other is beta thalassemia major, also known as Cooley's anemia, having two defective alleles. Now, pathophysiology of the thalassemia. So the anemia in thalassemia result from combination of inefficient erythropoiesis and increased hemolysis. These two are the mechanism. The degree to which both mechanisms continue to the severity of the disease depend on the patient exact genotype. The first mechanism, which is inefficient erythropoiesis leading to anemia. So in beta thalassemia minor and major, we have faulty beta globin chain synthesis. So the beta globin chain decrease while the gamma and delta chain increase. So the alpha chain combine with gamma and delta. When the alpha chain combine with gamma chain, so it forms HbF, which is fetal hemoglobin. And when the and when the alpha combine with delta, so alpha 2 delta 2 which form HbA2, while alpha 2 gamma 2 form the HbF. So in beta thalassemia, the level of the HbF and HbA2 will be elevated. HbF is fetal hemoglobin which is present in infants up to the age of 6 months, after which HbF production decline and symptoms of anemia appears. Normally the HbF is present up to the age of 6 months. So after 6 months, the fetal hemoglobin is replaced by adult hemoglobin. In alpha thalassemia, intermediate HbH disease and alpha thalassemia major HB BARTs. So we have faulty alpha globin chain synthesis, decrease alpha chain. Alpha chain is decreased here. So impaired pairing of alpha with beta and gamma. So increase free beta chains and increase free gamma chains. Increase free beta chains which form beta tetramer known as HbH disease, while increase free gamma chains form the gamma tetramer known as HP BARTs. In minor and minima forms, production of the affected chain is reduced, but enough is produced to prevent severe anemia. Another mechanism is increased hemolysis. One of the chain, either alpha or beta, is reduced, so compensatory overproduction of other chains. Excess globin chain precipitate and form inclusion within the RPC, so erythrocyte instability with hemolysis. And anemia, so we have increased erythropoietin occur in response to anemia, and bone marrow hyperplasia occur, and skeletal deformities are also present. Then we have clinical feature how the patient will present. So beta thalassemia minor variant no or mild anemia and low risk of hemolysis or splenomegaly, while in major variant we have severe hemolytic anemia that often require transfusion, secondary iron overload due to hemolysis, transfusion, or both. So secondary hemochromatosis occur. So in major variant, the hemolysis occur, and hemolysis and transfusion can lead to secondary hemochromatosis. Also, it can lead to hepatosplenomegaly, growth retardation, and skeletal deformities like high forehead, prominent maxillary, and zygomatic bone. So these are the images where we have prominent maxillary zygomatic bone, and we have high forehead here as well. This is another picture showing the same findings. Transient aplastic crisis, which occurs secondary to infection with parvovirus P19. Now we have alpha thalassemia. So alpha thalassemia, we have silent carriers having typically no anemia. In alpha thalassemia trait, we have no or mild anemia, while in HPH disease, there will be jaundice and anemia at birth. Chronic hemolytic anemia, they may require transfusion. So secondary iron overload due to hemolysis, transfusion, or both secondary hemochromatosis, hepatosplenomegaly. Skeletal deformities uh, are less common as compared to the beta thalassemia, and compared to thalassemia, beta symptom in adults are generally less severe. HP BARTS, which is also known as hydrops fetalis. So it's the most severe form of alpha thalassemia. So the hydrops fetalis present as intrauterine ascites and hydrops fetalis, severe hepatosplenomegaly, often cardiac and skeletal anomalies, incompatible with life, death in utero or shortly after birth occurs. Now diagnosis. So